Primary care networks are really the cornerstone of our integrated care systems in North East London. It's about delivering a holistic care to our patients and service users.
General practice now really have got some passion about what they're doing because they're seeing the changes in health outcomes for their patients and our residents.
So I think the point of networks is to say, how do we enable primary care to be part of community care, acute care, together, so services are joined up around the needs of patients.
Before, GPs used to be lone wolves. They used to just work independently, but we've made a conscious effort to unite and join together to form networks.
They're the place where patient experience and quality of care really needs to be driven and improved and delivered. Primary care networks are groups of practices that work within the same geography.
For the past 4 years we've been working on networks and in terms of their integration with other local providers, our acute trust and community and mental health trust. What it means is that we're able to coordinate care, we're able to deliver proactive care and accessible care, which is our strategy for London, and it's becoming real for us out in BHR.
The purpose and vision of what we're doing really is to facilitate, support and strengthen general practice.
Well, the point about operating in networks is that the practices in that network can know each other. Their population often can have distinct needs, and so you can tailor whatever the offer or the service is to the specific needs of those practices.
So from a patient's perspective, the benefits of having groups of practices working together with their community services, voluntary sector organisations does have a real effect on making sure people get their blood pressure checked early, their cholesterol checked early, and for long-term conditions such as diabetes or chronic obstructive airways disease at a very early intervention.
Atrial fibrillation, we're now the second most improved CCG area in the country if you look at previous year, and that's really brought the feeling of achievement and what can happen if you start working differently.
Networks are important because they can actually make a difference to the health of the local population, make a difference to individuals' lives, not just the care they receive, but keeping them healthier for longer, stopping this sort of tsunami of long-term conditions that we know is coming down the line, but actually making people's lives better.
Already patients have seen that if they can't get a GP appointment at their practice as an emergency on the day, the use of the hubs that Redbridge run has really helped with on-the-day access for patients.
Practices and clinicians will equally benefit from a number of these changes. I think partly because of the approach to workforce planning and workforce design.
Since joining as networks with other practices, I'm using the wealth of experience of older GPs, more experienced GPs, getting that sense of camaraderie.
So people beginning to own and have a joint vision, but also a joint direction. There's a lot of excitement because practices have really been able to iterate the model and really make it work well for them with the other providers.
Also brings the opportunity for people to work in a different way with a real focus on improving people's work-life balance.
It's quite powerful when a GP comes and says what a difference that role has made to my working day. It now gives me back an hour and a half of my day.
Part of that is also continuing to work in developing the GP Federations, who we believe are really critical in supporting primary care networks develop, again sort of taking on some of the burden perhaps that have previously been sitting within individual practices.
In Redbridge, how do you get 40 practices, all with maybe different viewpoints, to have a say? With a single federation we can create really clear messages and actually start to influence the way decisions are made.
A lot of initial work was involved in engaging with practices at various events to get buy-in from practices.
So there's been a group of people, a cohort that's gone through a training programme about what quality improvement is, the different methodologies and techniques, and then every practice in the borough has also participated in that quality improvement programme.
Part of the work that we've been doing across North East London as part of the primary care strategy has been about sharing that practice and sharing ideas.
So we're starting to sort of break down fragmented care work collectively together through multidisciplinary teams. A good example in Redbridge is our social prescribing scheme.
A big thing that we are concentrating now on is frailty.
We're identifying all the patients in Redbridge who have moderate frailties and making sure that they've all got a care plan.
We're starting through the GP Online is to increase the number of patients that are able to register online, book appointments online, get the repeat prescriptions, but also see their records online.
Federations as enablers of networks can be a really powerful thing.
We have built the bridges so far in our networks, so we have joined together. We have had great engagement. The future is just developing in that.
I feel really positive. It does feel more joined up. It does feel that we have a common purpose. People are now really starting to break down some of the barriers. The energy really comes from actually going out and doing some of this work now rather than talking in theory what do networks mean. So we are really trying to make them live. There's good momentum. People can see a change. There's new roles coming in that are making difference to practice staff, to their resilience and retention, but also the outcomes, because that really is what drives clinicians locally. It's seeing the health improvements and being proud of the changes that they can make.
The reason why we can find GPs potentially getting excited about networks is that ability to impact on lives and actually make a difference, which is what we all get out of bed for in the morning.
I now see a future, and the future at the moment is networks.